parked exits and the congregation point is at the rear of the building on exchange flags. Toilets, including accessible toilets, are out through the corridor to my right. If you're invited to speak, can you please use microphones and put any mobile devices to silent, please? Thank you, Chair.
Hi. Welcome to the meeting. Nice to see the ones that are here. Anyway, we've got a long list of apologies tonight. So the apologies at the moment is Linny Hinnigan, Councillor Hinnigan, Councillor Claire McIntyre, Sam Gorst, Robert McAllister-Bell and Sarah Thwaites and Hazel Brown. So are there any further notifications at all?
Councillor Billy Lake's just submitted his apologies as well, Chair.
Sorry, who? Billy Lake. Oh, Billy Lake, okay. All right. Right, so can I invite members and officers to introduce themselves, please? So I'll start with me. I'm the chair of the committee, Councillor Roz Gladden, chair of the committee. Oh, he's done him.
Councillor Fraser Lake, Cabinet Member for Social Care and Health.
Matthew Ashton, Director of Public Health for Liverpool.
Councillor Natalie Nicholas.
So Gavin Flatt, Head of Policy and Strategy for Public Health, Liverpool City Council.
Carol Hill, Director of Strategy, Comms and Integration, Liverpool CCG.
Fiona Lemons, GP, Chair of Liverpool CCG.
Councillor Liz Parsons.
Councillor Colin Smeeder.
Councillor Helen Thompson.
Vicky Metcalf, Communications Team at Liverpool City Council.
Johnson, MD with Cobra Design.
Caitlin Ruddy, Participation Officer for Looked After Children.
Jack Collins, and with the Children and Care Council.
Julie Cashin, Children's Rights and Participation Manager.
Anne Belder, part of the Children and Care Council. Kirsty Melanie, Participation Officer for Children, Looked After Children in Liverpool.
Declarations of interest. Any declarations of interest on any item on the agenda? Yeah.
Chair, declaration pecuniary interest by way of work for item 7.
Okay. So if we go through the agenda, the minutes for the last meeting. I'll go through it page by page if you look for accuracy, and welcome Dorcas. Okay, page 1, page 2, page 3, page 4, page 5, page 6, 7 and 8. Any matters arising from the minutes? No? Okay, good. So have we got any submitted questions, Peter?
Yes, Chair, there was one submitted by Councillor Liz Makinson that has been responded to and has been circulated and will be appended to the minutes. I've got spare copies here if anyone wants one.
Okay, that's great. So, Fraser, we'll go straight on to your Cabinet Member update if we can. Thank you.
Of course, thank you, Chair. So just to update the committee, obviously as a result of the last select, there was an action for me to write over to Bill Addy from the Liverpool bid in regards to public access defibrillators. Just to inform the committee, obviously the letter was appended to the report. I've got a meeting arranged with Bill in the next few weeks, so I will bring that progress back and update members to what's going on there. What I want to do is, as always, it's the expectation that members will have already read the report that's been submitted. So I've done a verbal report where I'll provide more information on different things. So starting off with public health. So firstly, I want to touch on a serious issue that's appeared in recent reports, and that's in relation to some people in our city being spiked whilst on a night out. This is absolutely disgraceful, and the fact that people think that this is acceptable to do in our city is nothing short of abhorrent. And how dare people compromise people's safety in this city, residents and visitors alike. It's an absolute disgrace to everything that we stand for as a city, and I want to condemn that behaviour and make sure that that's known. So I want to put a message out to residents and visitors to our city that Liverpool is one of the safest cities in the UK. And the nightlife that we've got attracts visitors from all over the country as well as from the region who want to enjoy the facilities that we've got. And that's why we are awarded purple flag status for more than a decade every single time. We're working as a council really closely with Merseyside Police on this to ensure everyone's safety, and I want people to feel safe in the city as they should do. Every weekend there's robust and proactive policing that's going on within the city centre and the town centres across Merseyside where there's an active nightlife. And that's in place to protect vulnerable people, identify potential offenders, and also support any victims that they come across there, as well as providing a visible and reassuring presence. I want to urge everyone to be on the lookout for any suspicious behaviour, and I know that this has been published as well across the council, and be in the know when it comes to recognising any potential symptoms if somebody has potentially been spiked, which obviously can include but not limited to any feelings of sleepiness, dizziness, nausea, speech difficulties, any confusion. If you're in any doubt, reach out to someone who you're there with, whether that be a friend, a member of the venue staff that you're at, or whether that be to the emergency services. This is something that we're all taking extremely seriously. So moving on to community engagement, as it was mentioned in the submitted report, our teams are continuing to hand out testing kits to areas based on lower vaccination uptake and higher COVID rates. This is part of the citywide response that we've got, and we'll continue to make sure that we share all these messages on our channels. And also there's the weekly councillor email that goes out with regards to COVID updates. So we'll continue to make sure that we do that and encourage all elected members to share that around their networks as well, please. In terms of vaccination rates, as of today, and the data itself it always lags a couple of days, just depending on when we can get it. So as of today, first dose is at 68.1% and second dose is at 61.3%. So to add on to that, we've got the lowest vaccination rate in Cheshire and Merseyside, where approximately only 64% of adults have had 2 doses. That might sound high, but it's not. And it's reflective in the case numbers that we've got, which are plateaued at a high level at the minute. It's never too late to obviously have your first COVID vaccine, even if you've had the virus before. So I want to just encourage people to not delay that. This will help, and it will protect you and those around you, including the vulnerable and the elderly. Most hospitalised COVID patients that we're seeing are unvaccinated, and on that basis we need to make sure that we are spreading that message out as much as we possibly can. That includes people who are pregnant, so if you're pregnant, get vaccinated. COVID is obviously dangerous for you and your baby and is leading to unvaccinated pregnant women being hospitalised and in some cases also being admitted to intensive care. It's much safer to be vaccinated against COVID than to get COVID whilst pregnant. As with all of our vaccines, they're able to be booked on the NHS website or through the CCG website as well, where we've got drop-in clinics where no appointments needed. One of the things that I would say, and this is also going out across as a shared message, is just making sure that if you are in doubt or there's any hesitancy, get your information from a trusted source like the NHS, rather than believing something on social media. Misinformation is really common and it's dangerous, and actually it puts lives at risk. So we are heading into winter and preparing for this, but we do expect a difficult winter ahead because of the lack of people mixing and socialising, as they will have done during lockdowns and in those social settings. I wanted to advise the committee that I know that there's been publicity surrounding a COVID pill as well that's been in the media, which is apparently 89% effective against high-risk cases. This particular pill obviously hasn't been approved by the UK regulator as of yet, but if any further information comes back, I'll update the committee on that. But that shouldn't be detracting people from the message about getting vaccinated. vaccination is still the best way to protect yourself and others against the worst possible symptoms, which usually lead to hospitalisation. So with regards to hospitals and NHS pressure, I want to touch on that as it has been, and this is probably going to be something that might be a standing item that I raise, because one of the items that we had through the roadmap to get out of lockdown originally was to make sure that the hospitals weren't put under unsustainable pressure and the NHS weren't impacted in that way. Given the fact that we're seeing high levels of occupancy within critical care and intensive care and the accident and emergency departments, that's something that we need to make sure that we have a tight grip on. We've got no capacity with regards to ICU spaces across the hospitals in Liverpool. And I would ask people to be mindful what they're going to hospital for or calling an ambulance for. And that's not to say that help isn't available, but just about asking yourself, actually, is this the right avenue for me to go down at this moment in time? We've got medical advice which can be provided by other health professionals such as pharmacists or GPs as well, but I know Carol will touch on GP access a little bit later. And it's also been announced today that all frontline NHS staff in England will need to be fully vaccinated against COVID by next spring. So more information on that will follow in the future, because that's only obviously been announced today. So touching on adult services then, with the mandatory care home vaccinations. So as we've discussed at the committee previously, the regulations now come into force on Thursday the 11th of November, so this Thursday. So it's expected that all those staff, unless they're medically exempt, will be fully vaccinated by this date in order to continue within the role. We've been working with all of our colleagues who are in scope for this change, because it applies to professionals and tradespeople who enter the settings. Through working with our teams, we've either offered redeployment to all the staff in the hubs who are not vaccinated, and or they've been vaccinated themselves. So we currently have a number of remaining social work staff that we need to review the proportionality of their role and actually within the care hubs and try and reallocate workloads. There's been no dismissals as a result of this change in legislation, and I'm hopeful that this will be the case throughout as we have those final discussions with colleagues. I also want to talk around, in the media, there's been some criticism around asylum seekers and the initial accommodation, so I wanted to touch on that point as well. So can I clarify firstly that within the accommodation for asylum seekers at the moment, that's being facilitated by the Home Office and Serco, but I wanted to touch on this because there's been several concerns raised by members and also in the media. So we've been hosting multi-partner meetings regarding asylum seekers for a number of months, and those meetings are inclusive of Home Office, Serco, health providers and the voluntary sector, and that's to make sure that those who are accommodated are getting the most out of that, and any issues that are raised are dealt with as swiftly as possible. So we've made efforts to reach out to Serco, and they're going to be investigating the issues that we've raised. We've raised the issues with the Home Office and have yet to receive a response from them. In terms of our private sector housing team, they're aware of the issues that are going on as well that have been flagged, and the Home Office have explained that the hotels that people are currently in are temporary. However, that's being said, but they've been in operation for a number of months, and additional hotels are also being populated despite our advice. So we engaged with the Regional Strategic Migration Partnership as well to raise these issues, and they advised that if we can provide more clarity on specific issues that we've got there, for example, like there was an article in one of the local newspapers, and there was a discrepancy, like a picture shared was actually from Southport rather than from Liverpool, but then we'll make sure that we raise the right issues with the Home Office there. On the back of these reports, I've requested our councils, our Liverpool team, to go out and visit the hotels and speak to some of the people directly rather than relying on third-party media, and actually finding out about people's experience firsthand to ensure that we use that evidence to advocate for any improvements that may be necessary to feedback. I also want to bring people's attention to the consultation that's currently open on our draft homelessness and rough sleeping strategy. So the consultation started on the 19th of October and runs until the 24th of November. So I really want to encourage everyone to take part in that, because it's useful to hear everyone's thoughts. We're asking people to give us their views on the city's vision to ensure that everyone's got a right to a secure place to call home, a part to play in the community and a purpose for their lives. Multiple partners have collaborated in the development of this thinking, but it is important that everyone has their say and that say is heard. So the purpose of this is to gather as wide a range of views as possible to inform our plans, and then these will be presented to our homelessness forum and will be used to redefine the strategy. For anyone wanting to participate, you can either go on the Council's consultation website, which will be included as part of the report, or if you need something in an alternative format or a hard copy, you can email Anne with an e.doyle@liverpool.gov.uk, and then I'll get a copy arranged for you of that consultation so you can take part. So talking around children's services and social care, don't worry, we're on the home stretch now. I'm very conscious that my voice is just reverberating around the room. So talking around the household support grant. So with this grant funding, we've ensured that this will be used primarily to support households in the most need with food, energy and water bills. But it can be also be used to support households with essential costs related to those items and wider essential costs. And in exceptional cases of emergency, it can also be used to support housing costs if no other support is available. I've also allocated funding as part of that towards the no recourse to public funds population to try and ensure that everyone is protected with the appropriate levels of support. So on Children's Centre, I wanted to touch on the fact that we are going to be transferring the management and delivery of Children's Centre services in Fazackley, Croxteth, Stonycroft and Notty-Ash Children's Centres from Barlow's Primary School to Liverpool City Council. I wanted to just clarify that any such employee will transfer on their current terms and conditions, which will be protected, save for limited circumstances. Families will continue to receive the same service from the children's centres, and all staff transfers will remain in their current positions and location, and there will not be any change for families or how they use the centre. The last point that I want to raise is just, I flagged this time and time again about our vacancies within social care. We really want to make sure that we're pushing that message out there. So if anyone is in this room or watching online and you've got somebody who would be interested in joining our social care teams, the feedback that we get from our staff is that they're really happy around working for Liverpool, and there's a positive culture within Liverpool City Council that they want to be part of. So I want to encourage everyone to do that. The details of which, again, I'll make sure are appended to the report so you can apply. And finally, Chair, I just wanted to take this opportunity, as always, to thank the teams in children's, adults and public health, who do an absolutely amazing job, and I'm honoured to play a small part in their team structure there. So thank you.
Thanks, Fraser. Have we got any questions for Fraser? Liz?
Thanks, Fraser. Thanks for the report. Just a clarification, sorry. When you were talking about the issues with asylum seekers being housed in hotels and working with Circle in the Home Office, are you talking primarily about people that have come from Afghanistan and the fact that they've not been funded by government yet and that situation? Or are we actually housing asylum seekers who have come into the city through other routes in hotel accommodation at the moment?
So in regards to the population I'm talking about there, that is from Afghanistan at the moment, and that was what was shared. The reason why I just wanted to bring it to the committee's attention was because it was shared in the media, and actually I'm talking around dispelling myths and things that are going around, so I wanted to make sure that I'm bringing that clarity so members have got the correct oversight. But yeah, thank you.
Thank you, Chair. Thank you, Fraser, for the report, all the information. I have a question in regards to the vaccination for social care. So what is the uptake so far, do we know, and is there any contingency plan if there are staff, because obviously in care homes there is already a shortage, and if there wasn't that uptake, what contingency plan do we have?
Thank you. In terms of the uptake that we've had, I haven't got a direct number on it at the minute for a specific number. However, the uptake has been really positive within staff there. Like I said, we're just working on the social care population at the moment and assessing how much because the legislation change and the regulations include different tradespeople, people who aren't necessarily there all the time. We're looking at how much they're on site in order to be able to assess whether they fit into that category. So we're making sure that we're working hard with those, and then where there's been some colleagues who don't want to be vaccinated for whatever reason, we're working with them to address any concerns that they might have in the first instance. But obviously, if that's not something that they want to do, then we're having those conversations separately as well, just to make sure that we're looking after everybody in the right way.
Page 20. It's about the, the vacancies of 49 vacancies for social services, social workers. Page 21. What are the impacts of these 49 vacancies on staff and services being provided?
So in terms of the impact, obviously the impact is we've got caseloads that don't go away. We've still got children and young people that still need to be supported. So caseloads are impacted in the fact that we've got the vacancies there, also the delays for people graduating from their degree because of things like the pandemic, as well as also caused an additional struggle. So although we've got people in place who've been selected to be appointed in the role, they've not been able to start yet because their formal qualification hasn't been signed off because of delays there. So it is causing concerns around pressure. But the Children's Services team, we are working closely together to make sure that everyone who needs support is offered it. And actually, we're working really closely with our trade union colleagues as well to see if there's any support that we can offer to them, that to our members of staff, then we will do.
When there is shortage of staff, it has impacts on those working, and you might get people going off sick as well. So that you have more impact. It's just about having strategy in place to make sure we can support the staff, as well as making sure services are not affected. The other question I've got is not a question really, pages 25 to 26 and 29. There are a lot of acronyms which I was trying to find out what they are: CPP, CLA, CIN. I think they're just acronyms, but I couldn't find the full word for them.
So, no, that's first of all, I completely take on board your point. So I'll just address those in each order. So in terms of what strategy we've got, we're currently working on a recruitment and retention strategy, and that includes within children's social care, and that includes looking at caseloads that we've got, looking at what we can do to support our staff. We understand that everyone's absolutely battered at the minute, and we're not taking that for granted at all. So it's around what we do. That's going through some formal procedures at the minute within our leadership of the council and from a corporate management side with officers. So once we've got a strategy that's put in place for retention and recruitment, I'll make sure that I bring that back to the committee to update on. With regards to the acronyms and stuff, and the abbreviations, so it was raised at a previous select, and to be fair, what I'll do from now on, I did attach at the last select committee a key which puts them all on. What I'll do from now on is I'll get Peter to attach that abbreviations list every committee, just so that everyone's got a bit of an oversight on it. So apologies for that. I'll make sure that's done for next time. Thanks, Dorcas. I don't mind. That's what I'm here for. Thank you.
I'm glad about that. Okay. Any more questions? No? Oh, not really, Kim. You're not allowed to ask questions within. Sorry. Yeah, I want to ask a question about the social work degree apprenticeships that are there. That's excellent. We always used to do that. We've had that for a long time, so it must have stopped presumably at some point recently. Is that just for children's social workers, or is that for adults and children's?
It's running parallel between adults and children's, Chair. So that's something that we've got a pilot of at the minute, just to see how it's working, and then based on that, we'll then hope to increase it, because actually there's no reason why we wouldn't want to. We've already got some staff who want to make that progression, so actually allowing that step there to facilitate that for them to step up is the right thing to do.
Okay, so presumably that's for unqualified social workers, is it?
It is, yeah.
Yeah, okay. Well, obviously, yeah. So, yeah, thanks. To introduce the update from Children Care Council, please. I see Jack's there. Jack was quite a star from a previous, yeah, for a previous meeting.
And this is our lovely Relda next to me. She's the next star in the making. This is Relda and this is Jack.
Yeah, thank you. I mean, I don't mind who gives the report. Who do you want to give the report?
Both of them. They've both got it.
Okay, that's good.
Hi everyone, my name's Relda and I am giving you the Children and Care Council update today. Over the summer we had our scrutiny panel with Steve and Fiona. It was so nice to be face to face after a distance on the grass in Sefton Park. Taisha, myself and Barney met with the DFA to talk about unregulated placements for young people, and that the difference between a semi-independent unit and a children's home. The young people spoke about their own experiences and gave their views on what they think a semi-independent unit should look like. This also led to conversations between carers and young people about their future. After 2 years, we ran our summer project again this year. There were 6 young people from Liverpool, 6 from Knowsley and 2 from Sefton. It was good to meet young people in care from different boroughs. During the summer project, we did a number of different activities, including a graffiti workshop with Zap Liverpool. We visited the Anthony Gormley statues at Crosby Beach. Ali was amazing in her singing. She has a beautiful voice. Jack and I was invited along to speak at the launch of the ADHD Foundation. At this event, we spoke about our experiences of being in care and how we feel if we had something like the Umbrella Centre when we were in care, it would have been a huge help for us. We wish the centre good luck and hope to work alongside some young people to engage in their opportunity. We recently celebrated Care Leavers Week with the participation team putting on a little event for us to get all together with PAs and senior management. The turnout for this was amazing, as initially there was 20 young people invited, but we had 37 attended. This included our UCAC and care leavers and their babies. I'm going to tell you all about the changes this Children and Care Council have made recently to how the groups are going to be run. We now have an under 18s group, unaccompanied asylum seeker group, bump to babies, and a leaving care group. This is so we can focus on the main issues during these groups age appropriately. We are working with Fiona and Dave Crow, is that how you say his name? Yeah. On putting something in place to avoid our belongings going missing when we have to move, as this is a huge effect on us, as some maybe have sentimental value to us. We know how important education is, but we also know that many young people find it difficult to engage or have many issues to attend. So what we can do to ensure that we are doing the right things to get them there every day, what can we improve or change to make their experiences better? Thank you.
Hi everyone. Can you hear that? Yeah. Oh. Hi everyone, I'm Jack. We got invited to talk at the budget meeting last week. Unfortunately, it was cancelled. We wanted to put our ideas of savings to you all to see your thoughts. Firstly, we would like to speak about is teenagers in foster placements. A lot of us are in foster care from a young age, and we think that once we turn 18, we will get our own place. It doesn't really work like this. When we were under the age of 18, we have supervised contacts with our parents 6 times a year. It was, in my case, I had support from my foster carers. What I thought was preparing me for my future, I was wrong. Once I turned 18 and there was no plan in place for me, I had to go back and live with my mum, although our relationship was strained due to only having contact 6 times a year and not fully understanding why we are in care in the first place. To save money and prevent young people getting to the age of 18 with no plan and nowhere to go back home with our family, can work not be done with our parents and us to build up a relationship and get support put in place to get us home sooner. We understand this is not appropriate for everyone, but we think this would save a lot of money and resources in the long run and make our future brighter, because instead we would be 18 years old, living life and having fun. We also think another way we think you could save money is ensuring someone specific is looking into our parents' benefits when we come into care, as if they are still getting benefits for us. Their full rent paid and contact with us each week. Why would they fight to get us back? Our parents' benefits need to be stopped as soon as we go into care, as if they are not looking after us or providing for us. They are not entitled to that money. We feel this would give our parents a kick up the backside to start making changes to their lives and start fighting for us. This would then save you money. This would then save you money. 1, not paying benefits to people who are not entitled to them, and 2, it may make our parents fight harder to get us home. Young people living in children's home, I understand that young people come into care for reasons, however, the plan should always, in most cases, be to work with the families to get them back together. If we put more resources like this, like family support workers or counsellors into helping our parents get the help they need to become better parents for us, the length of time we are in these high costing placements would be a lot less, as once the work with our families is done, we can potentially go home. Thank you for listening. Is there any questions?
That's a pleasure to listen. That's great. Thank you both of you. Have we got any questions for our Children Care Council? Fraser? And you're going to respond, are you? Okay. Okay.
So, firstly, thank you so much for that. Mine's not exactly a question, more of an invitation, really. So if we could get together at some point, we can go through some of your ideas, and we'll definitely take them on board as we make this, as we go through like our budget consultation and stuff. So nothing's finalised as of yet. So let's link in and we'll hear views from everyone, because I'm not going to be hypocritical and say we'll hear it from everybody and then not hear it from you guys. So let's have a longer conversation at another point and we'll link up with that if that's all right with you. Perfect. Thank you very much.
Thank you, and thank you again for coming to the committee, and always really proud because you present so well, so big thank you for that. And also I should say again, sorry, but really proud of Julie, who got an MBE at St George's Hall on Friday. So, congratulations again. Yeah, so apologies, we did organise a budget consultation session, but we've moved it to the 23rd of November. We've invited the Children Care Council along with lots of different people who are working in children's services. So we've rescheduled that. And also, I just wanted to say thank you as well, because Children Care Council reps have been sitting on a few interview panels recently and have helped us appoint some really great managers in children's services. So thanks for that.
Oh, Liz.
Thanks, Chair. It's more a comment, really, listening to what you were saying, Jack, because in a previous life I had 17 foster children, and I think what's, for all of them, regardless of situation, what as professionals working with children in care you have to realise is that all of them just want to be at home with their families, regardless of what the situation is. And I think it's really important that we listen to what you've said and look at how we holistically support families in the city to make sure that actually we're not viewing this is a child who's here and our responsibility is just to care for the child, but to actually make sure that we can put that support in place to get you home quicker. So I just wanted to say thank you for reminding us of that, because it's really, really important.
Thanks, Liz. That's brilliant. Thank you so much. You're welcome to stay to the rest of the meeting. Julie?
We are ready to leave because we've only got a couple of hours on the ticket. But can I just ask, we're doing the Christmas, sorry Steve, I haven't done this past you, but it doesn't matter anyway. I'll just pretend that you're not there. But we're doing the Christmas care leavers appeal, but we do understand that situation's completely different this year financially. But we've gone from looking after Christmas presents for 90 kids to 360. Now we've got donations coming in, but I was just wondering, Fraser, when you're giving money away, could we have some fuel vouchers for the care leavers that we normally get for Christmas? Being looked after right through the pandemic, because I've got them all out to them, but it's just been knocking on the, I can't hear a whisper to say whether we're getting them for Christmas, so I thought to ask you for direct.
Yeah, I mean, first of all, like, yeah, that's by all means. I sometimes pretend Steve's not there as well when I want to do something. Yeah, that's something we'll definitely get on, and I'll make sure that we get onto it tomorrow.
Sorry, declaring an interest to work in a children's centre, but I was just about to say that at the moment our children's centres, a lot of them have actually got fuel vouchers for people. So I know that in mine at the moment I've still got about 80 that have got to be used before December, and I know other centres are probably in the same position, so it may be worth linking with Deb McAndrew.
Give it a ring tomorrow.
Yeah.
That's brilliant, yeah. So thanks ever such a lot. I'm disappointed you don't want to stay. I mean, is there anything we can do? Steve will tap dance. So thank you so much. Thanks very much. Thank you. Sorry, no idea where we're up to now. Right, okay. So it's agenda item 7, new integrated sexual and reproductive health service for, yeah, Natalie's declared in. So you leaving, Natalie, yeah, for Liverpool. So 3 years ago, this committee participated in a Centre for Public Scrutiny Inquiry Day, which reviewed the effectiveness of local services around sexual health, reproductive health and contraception services. Following recommendations from the event, a Cabinet report was received last year by this committee, in October I think it was, as pre-decision scrutiny seeking to procure a new service delivery model to replace the previous model, which was deemed no longer suitable for purpose, fit for purpose. So the report on page 27 to 34 of this agenda outlines the successful procurement which will deliver improved outcomes across the city. Can I invite Matt Ashton to speak to the report, please?
Thank you, Chair, and I'm delighted to be able to bring this report today on something that I think is a really good news for the city. So this is to inform Select Committee about the successful procurement of our new integrated sexual and reproductive health service that will deliver improved outcomes across the city. And as you said, Chair, we have a responsibility, a mandated requirement to provide sexual health services for the local population, including HIV and sexually transmitted infections testing services, STI treatment services and contraceptive services. We also know that sexual health need is high in Liverpool, and we have previously had a very good but fragmented service. And so through the consultation processes that you've described, including previous engagement with this committee, we have designed a new sexual health and reproductive health service, which went live this month. Just to draw out a few points of that. So it's called AXIS, AXESS, AXIS Sexual Health. And there's a communications plan, a training plan and workforce development plan around that offer, so people know exactly where to go, why and when. The model includes critical new features designed to put prevention and demand management at the core of the provision of the service. That includes prioritisation of prevention, increased awareness raising, campaign work, a more accessible service for all, including a digital and e-service, a centralised digital front door with booking system, advice, information, and ordering of testing and contraception, highly skilled trained staff at multiple sites across the city, a coordinated approach to sexual partner contact tracing, improved access to HIV testing, routine provision of PrEP, improved access to specialist long-acting reversible contraception provision, greater provision via pharmacies, and close alignment with the general practice service delivery. In terms of the outcomes that we're expecting as a result of this service, things like a reduction in under 18 conceptions, pregnancies and abortions, a reduction in repeat abortions, early presentation of those with unplanned pregnancies, STIs and bloodborne viruses, a deceleration in new diagnosis and repeat presentations of STIs, bloodborne viruses and HIV, a reduction in STIs citywide, a reduction in onward transmission of STIs, a reduction in clinical complexity of presenting cases, increased identification and support for people who've been victims of sexual violence, exploitation and coercion, and a reduction in sexual and reproductive health inequalities across the city. We've funded this out of our core budget, so it's no additional pressure to the city, but it's an improved service. And we think this is an exciting change to our sexual and reproductive health service provision. It will allow our residents to have far better access to these services than ever before and provide a better range of treatment and care at each and every site. Just want to pay tribute, please, Chair, to the previous providers of this service and to the new provider, and we're really pleased to be able to present this to committee today.
Thanks, Mark. Really appreciate that. Are there any questions? No, it's all very quiet. Oh, sorry, Helen.
Thank you, Chair. Thank you very much for that report. I found it really interesting. I've got a couple of questions, just for clarification, really, just so that I understand how things work. One of the things you talk, I'll give you both questions and then you can answer them when, whatever order. You talk about prioritisation of prevention, increased awareness raising, and campaign work. I'm not aware of anything at the moment. I just wondered what you're doing or what you're going to do. I imagine that will be a huge uphill battle, given that everybody's already a bit weary about all the COVID information. And then my other question has to do with what's different about the way you're conducting the service now that will mean that there'll be an increased identification of people who've been victims of sexual violence. I wonder how things are different, that's going to be improved.
Chair, I think in order to do justice to those questions, I think I want a fuller response from my sexual health lead. So if that's okay, I'll take both of those questions away and get a response back.
Will that'll be available to everybody, not just me? Yeah, thank you.
Yeah. Can I just ask about, I mean, I have absolutely no idea what PrEP is, but obviously other than that, so, you know, what's the eligibility criteria for this? How is it, you know, how do we get out and about with this? And it sounds brilliant.
It's an open access service, so it's everybody. Yeah.
Yeah, and you get that out in the community so people are aware that they can have this.
Yeah, absolutely. But again, we can put the website in the link afterwards so that people can see exactly how they can access the service and the information around it.
Okay, so has Take Up been quite good about this?
It launched on the 1st of November, Chair, so it's really early days.
3 days, 5 days, yeah. The other thing is we know that there's a very high risk student intake for STIs. How are we going to be delivering that service to try and deal with this in a better way than we have done previously? And is that existing at the moment? Have you got a service that's out there?
Yeah, well, it's the same way. So it's an open access service. But what we would do is work with the universities, student facilities, student health services, and make sure they're connected in together.
Okay, all right. So we're getting out there, yeah.
Yeah, just to answer one of your questions, then, Chair, that PrEP is pre-exposure prophylaxis, which is used in as a preventative method for people who are at higher risk of contracting HIV.
It sort of says that there, but I'd not heard of it before, so I was. He's not got an agenda, Peter. Shocking. This report is for noting again. Is this agreed? Oh, sorry.
It's all right. Sorry, Chair. I was just wondering if we could have, because obviously the 2.2 talks about the drop in people accessing contraception. This was pre-2020. Is it possible that we can have the updated data circulated for what's actually happened to rates of people accessing services during the pandemic?
Yes, that's fine. But it might be worth waiting to see the impact of the service as well. So I don't know whether you want to take both of those or wait.
Do you want to do this?
My experience is the health data is not massively quick. Feel free to correct me. If I wait, how long am I likely to be waiting? Thank you.
All right, thanks. Dorcas.
Can I just ask a quick question as well? You know, you mentioned about prevention, yeah? So, you know, with the role I'll be doing that as well, because if we can prevent the STIs and sexual transmitted diseases, it's better than treating them. And I think we should, all energy should be put on preventing all these diseases, really.
I agree. I mean, you've got to do both, haven't you? But I absolutely agree with that. And that's one of the points of the service, is put more focus on that preventative sexual and reproductive health service.
That all questions, John? Yeah? Okay. So this report's again for noting. Is this agreed? Yeah. Nod of head will do, it's fine. Okay. All right, thank you. Yeah, go and get Natalie. Yeah, that's fine. So we'll just hang on a minute till Natalie comes in. I'll just introduce it now. So it's agenda item 8, NHS breast screening service programme in Liverpool. So in 2019, this committee appointed a scrutiny panel to look at breast screening services. After a number of meetings and a visit to a screening centre, the panel was paused due to long-term absences of the lead officer from NHS England and the lead officer from Council's Public Health. And then when it was due to resume, the COVID-19 pandemic meant all panels were put on hold, as well as the suspension of routine screening. So Natalie and Dorcas, you were originally members of that panel, that scrutiny panel, and you're still on this committee. I think it's intended that we now start to, we'll resurrect this scrutiny panel because it's an important piece of work that needs to be done. So the report on page 35 to 40 provides the latest update on the local screening programme, as well as a link to a report on reducing inequalities. Matt, can I ask you to introduce this item, please?
Yeah, Gavin's going to present this report. I think it's just worth saying that this is predominantly an NHS England commissioned service, and unfortunately NHS England aren't able to present the report today, so we're presenting the report, and if there are detailed queries about them, we'll probably have to take them away and bring the answers back at a later date. But Gavin's going to present. Thank you, Chair.
Thanks, Matt. So as Matt just outlined, this is presented on behalf of NHSEI. So in January 2021, a report was brought to the Health Select Committee, which provided an update. And as people were aware, in terms of the outbreak, and as the Chair mentioned previously, there was a pause in the breast screening programme between March 2020 and September 2020, following which it resumed in resumption in 2020. A recovery plan was put in place, and it was obviously at a national scale and a local level. And the report just outlines some of the problems faced when the service resumed, and included increased times required for appointments due to infection control measures, staffing issues, and outbreaks within the screening service, which meant the service was slower to recover than had been hoped. Obviously, national support around this to help recovery, and a number of interventions on a national scale and a local scale. And just to add, NHSEI have been working really closely with Liverpool, Sefton and Knowsley Breast Screening Programme to aid this recovery. Some of the things outlined in the paper are, for example, a development of a national round length planning tool, development of a national capacity and demand tool, and a workforce strategy to help the programme recover long term. The national date for recovery is set at March 2022, and the definition of the recovery is full clearance of backlogs and round lengths to be over 19%, with uptake at a good level. What I will say with the report is there's a lack of timely data currently available, and that's something we are working with NHSEI to bring forward to future meetings. So in terms of the inequalities discussion, as previously mentioned by the Chair, a group was established. We were looking at that, and a number of outcomes were ascertained. NHSEI report that the majority of those outcomes were met. However, there were some outstanding, which included ensuring equity in covering and access across Liverpool to breast screening service, and that is something NHSEI has agreed to reconvene to bring together a working group across for Liverpool, Sefton and Knowsley. So that will be recommencing. In addition, the same will be done for other screening programmes. So that's the update, and as Matt said, if anyone's got any questions, we can take that back to NHSEI on people's behalf and respond.
Thank you, Chair, and thank you, Gavin. It's lovely to meet you. Your predecessor, because as the Chair said, Dorcas and myself are the two members left on the initial scrutiny committee, and at that time we met with your colleague for NHS England, but I think she went off sick and then COVID hit. But we did make quite really good progress in it, and we were waiting for the report. So I don't know, since you've taken over that report, which looked specifically at the inequalities and the challenges, it would be helpful to see that report because we've been waiting on it for a while. Totally welcome this report in terms of the breast screening programme for Liverpool, because we even went out to the sites, we spoke with staff, Peter was there, and it was really, really helpful firsthand speaking to staff, hearing what the challenges are, and getting a better insight. So I even welcome hearing about the working group, because we weren't aware of this working group. So I don't know if it's something you're now going to start, or yeah. So obviously that working group would be helpful, and find out who are on the working group, if they're service users, because there's no good having a working group where the people who are affected aren't involved, and even the clinicians, to get an idea of what the challenges are. So really welcome finding out a bit more, because it's been a bit frustrating. COVID has been here, and it looks like COVID isn't going away. And what we find is COVID is draining all the resources we have, and that's human resource and physical resource, financial resources, because a lot of staff are off sick or succumb to COVID. But this is a really welcoming report, and I look forward, whether or not within the next 2 weeks we can have a meeting, if the chair would permit me. Obviously, if members here today would be interested in being in the committee, because I really want to see this moving forward. There are so many women, it's like a double whammy. COVID plus they haven't had the screening, and it's like a death sentence. So 2 years down the road, women who could have been picked up quite early and had the best screening and started therapy, basically it's 2 years of COVID plus to find out that, you know, the stage of your breast cancer, nothing can be done. So I feel it as a death sentence, as a female, and many females here, and you know, we have relatives who are female. It's really, really important, and that doesn't say that, you know, COVID or any of the other health issues aren't important, but we really need to get on top of this. And I just don't want to be coming back to another committee talking about it, but I really want to see something being done and meeting and looking at it. Thank you, Chair.
Thanks, Natalie. I think the decision has been made that we're going to press forward on this. Sorry, Matt, did you?
Chair, just in response to that, I think, you know, that you're absolutely right, and I think we share your frustration about how difficult it is to restart health services. It's not just breast screening, it's other screening services, and it's wider health services, and absolutely share the frustration. So with Chair's permission, we'll take forward that meeting, and we'll try and arrange that meeting with NHS England so we can have a discussion with them about what practical steps we can put in place over the next coming months. I have to say, though, that the system as a whole, as you know, remains under enormous pressure. So I think that the timescale that they have set for March 2022 for recovery is probably the one they're still going to operate towards, but it would be good to get some practical steps in place as we move up to that point.
Thank you, Chair. So October was Breast Awareness Month, and I think we missed a trick here, because in terms of, not a trick, or an opportunity to highlight, yes, because of COVID, but again, for people to do self-checks and things like that. So it's looking at things, yes, we're put under stress, but what can we do? What health information and messages can be sent out there to say we're still thinking about it? But again, because if you did do a self-check and you felt something was, you know, not right, you can go to your GP, you can get, you know, that sort of thing. So while we're waiting to resume, it's looking at how we can still be supporting women who are miss their call, for want of a better word. The other thing in the report, Chair, so in terms of item 5.0, public sector equality duty, equality implication and detailed consultation, I just think it's too many things. Just, it should not be grouped, and it seemingly dilutes the equality impact of it. And I have followed the link which takes me to the government website. It tells me nothing about the awareness and the risk assessment of what happens if those more at risk, or in terms of the equality impact. It just gives me government information, and I think by grouping that, it dilutes the whole importance of it. Thank you, Chair.
Okay, we are going to press forward doing this scrutiny. Have we got a show of hands here of people who'd like to be on that scrutiny panel? Dorcas, are you going to? Yeah. Natalie. Anybody else? Yeah, thanks, Liz. Oh, right, okay. Well, quite those hands there, did you? Okay, that's brilliant. Okay. I think it's really necessary. We have to press forward now, and I think we need to have a part in this that's going on. Is that okay? Yeah? Okay, so I'll ask Peter to get something sorted for a meeting as soon as possible. Yeah, okay. So again, the reports for noting, are we agreed? Agreed, okay, thank you. I keep turning this off. Moving on to item 9. At the last meeting, we had some queries raised about face-to-face GP appointments not starting as quickly as they could have done. And you did say you'd bring a report back, so I'm really pleased that this is here. So if you go on to page 41 to 46, produces an overview of the current pressures on general practice and the steps being put in place to address the challenges. Fiona, are you going to do this for us? Thank you.
Thank you, Chair, and thank you for taking an interest, and thank you to Carol. I think it was you that wrote the report, wasn't it? So thank you for that, and take that glory. I'm going to take the report as read. There's a bit of background there about general practice in Liverpool more broadly, and then it moves on page 2 of the report to talk about the reasons behind the pressures that general practice is currently facing. And I think at the time when you discussed it at the last meeting, it was the main topic on the news. It was a very, very hot topic. I can, from a personal perspective, assure you that I have never ever known general practice to be under so much pressure as it is currently. So the reasons for that, multifactorial. Big one is workforce challenges. So nationally, over the last 5-6 years, there's 1,800 fewer GPs, despite the government's repeated promises to give us 4,000, 5,000, 6,000 more. My own practice, we have lost 3 GPs in the last 6 months, all 3 of them because of pressure. Looking to reduce their hours. We've managed to replace 1 of them, despite advertising. And so we've got a smaller number of GPs, but a growing practice population and a growing population generally. It's a good news story. We are all living longer, but we are not necessarily living healthier, particularly in Liverpool. And so lots more long-term condition management adds to the workload in general practice. Obviously, the pandemic has had impacts for a number of reasons on primary care. Same as everywhere else, our staff catch COVID too, their children catch it. We have the issues with isolation. What you sometimes see in primary care is that a very small team can be very severely affected just by 1 or 2 members being unavailable. Despite that, practices have stepped up. We think roughly 9 to 11% of the figures that I've seen for an increase in the number of overall appointments that are being provided currently compared to this time last year. And there's some figures in the report there for you to look at. We've mentioned about recovery of hospital services. The significant waiting lists and backlog in secondary care is also impacting on primary care. A significant number of our patient contacts each day are people looking for support to manage their condition while they're waiting for either surgery, so that might be pain relief while they're waiting for a knee replacement, or medication being altered while they're waiting to see their specialist. In addition, primary care have delivered in Liverpool around about 75% of the over 700,000 COVID vaccine doses that have been given, and that has primarily been done by people doing overtime, working at the weekends, working in the evenings. We have to follow infection control measures, and that puts additional pressure again for small practices. That's a particular challenge for them. And then there's been some wider system pressures out of everybody's control about supply chain issues and lack of blood tube bottles, for example. Pleasingly though, the GP survey did show that 84% of people are having a positive experience and are satisfied with the service that they're receiving from their GP. We know that there's variation within that figure that needs to be addressed, but that's an overall positive number. And the report goes on to talk about GP access and the operating model, and this is where the whole debate about remote versus face-to-face consultations has arisen.
The operating model was dictated to primary care by NHS England at the beginning of the pandemic, and rightly at that time we were instructed to move to a remote triage service. And despite everything else in the world feeling like it's gone back to normal, we are still working under a standard operating procedure that instructs us to be mindful of social distancing and taking appropriate infection and prevention control measures, bearing in mind that people don't visit their GP practice for leisure and where they might choose to take a risk. Some of the most vulnerable members of our communities have to come to their GP practices, so we have to keep them safe while they are there. We have to keep our staff safe as well. And so the debate about face-to-face versus remote appointments has been quite polarising in some ways. One point I will make is that GPs prefer face-to-face generally. Certainly those of us of a certain age who are a bit older and were brought up to provide traditional general practice. I much prefer seeing patients face-to-face. You get much more out of it. However, we are now back to 57% approximately, and that's slowly rising, the percentage of consultations that are happening face-to-face. Pre-pandemic, the vast majority of practices were doing automatic straight to face-to-face with no triage. And there is a significant number of patients who found that really inconvenient. They had to take the whole day off to be able to attend a GP appointment. And so lots of patients are now saying to us, please don't get rid of the option for telephone. And I think where we need to get to is where we provide both. So that for things, particularly for follow-up of blood results, so that people don't have to take time out of work, for example, that we offer them that choice. And I don't think we should be aiming to go back to the levels of pre-pandemic face-to-face as a percentage. But it is about making sure that patients get the most appropriate appointment for the problem that they're presenting with. So what can we do about it? The report talks a little bit about the actions that the CCG is taking to mitigate some of the pressure in primary care. Our health report also mentions the 6 steps for using our service this autumn, big push on vaccination, etc. And we'll continue to promote that. We've also provided our GP practices with a toolkit to help them communicate better with their patients. NHS England and the government have announced some support for general practice to improve access as well, and the big announcement of an extra £250 million for general practice. The point I would probably like to make here is that even £250 million cannot buy you locums that do not exist. And my own personal experience is that every week our practice looks to cover the 2 vacancies that we've got with locums currently, and we cannot get locums. And even NHS England themselves did recognise that some of the additional capacity that the £250 million would buy would come from current workforce, so in other words overtime. And I can tell you now that the workforce, I think Fraser mentioned it before, is exhausted, and our staff have told us in no uncertain terms that they're not going to do any more overtime. And can I just make the point as well that we always talk about GPs, and yes, there's a problem and GPs are under pressure, but our staff are under pressure, and it's our frontline reception staff that are bearing the brunt of the abuse that is being directed towards primary care currently. And my own practice, again, speaking from personal experience, we've lost 5 receptionists in the last 9 months because they cannot bear to be spoken to like that. They cannot take the pressure. It is a really, really stressful job for them, and we have to support them as well. I think there's some other things in there that we can do to help. NHS England have talked about improving about data, and I think we do need to improve general practice level data. It doesn't really answer it doesn't really help us to answer the questions we're trying to answer at the moment. And I think I'll probably just close there. Just the conclusion says it all, really, that GPs and their teams and admin staff are working extremely hard to meet increased demand and the changing environment that we're all living in with COVID. And I'm happy to take, I could go on, but I won't, and I'll take questions. Thank you.
Thanks, Fiona. Thank you for that. So we got questions? Liz?
It's not a question, it's a comment. Some of us were having a discussion before we came in this evening, and you mentioned the debate being polarising, and what was really interesting was that half of the group, myself included, have had absolutely no access getting an appointment at any point during the pandemic. We phone up, we're triaged, we're either given appropriate treatment, or if we need to go in, we go in and see the GP. And again, I've got an appointment tomorrow morning with the practice nurse for routine asthma and blood pressure checks. All those things that I would have had before are still continuing, compared with the other people who can't get an appointment for love nor money. And I think that's the difficulty, isn't it, that there is such a disparity within the city of people that can feel that they're getting really good quality treatment, people that feel as if they've just been abandoned, and that's the difficulty. I mean, my own experience has been fantastic, and I'm one of those people who would say, please keep an element of phone to phone, triage. I've had blood results by text, I've sent a picture of something to my GP. It's worked really well for me as somebody who works. So I think it's a really valid debate as to how we move forward from this effectively, but the point is the disparity for people, I think, and that's what is causing such difficulty.
Yeah,
I think we knew about the variation even pre-pandemic, and the pandemic's just made it even more difficult for us to make progress on tackling that. That there are understandable, perhaps not acceptable, reasons for the variation, and not least of which is the fact that the number of doctors per head of practice population in the deprived parts of the city is lower than the number of GPs per head of practice population in our less deprived parts of the city. And I don't know, other than at a national level, how we can really tackle that. And I think that's a big part of what's underlying it. And then scale is another. We've got some very small practices that we try to support, and I think we've got some small practices who provide an incredibly good service, but we have some small practices that struggle because they haven't got the resilience within their teams. But we are aware of it. Thank you.
I quite like the fact that you can do either. I quite appreciate the fact that you don't have to go and sit in a GP surgery and wait for a face-to-face. And I've had my health checks from the nurse. I think the biggest thing that I hate is the 8 o'clock appointment thing of sitting on that phone redialing from 5 to 8 onwards, and then to find there's nothing left anyway. It's the most frustrating thing ever. It's really annoying. But I think the idea that this business about there not being enough GPs anyway. Any amount of money isn't going to solve that. It's going to take a long time to get GPs through, even if they want to do it anymore. Do you think it's perhaps something that people don't choose to do now, that they've seen the way it happens and they choose not to do it?
Couple of
ways of looking at that is that younger GPs certainly don't want to be partners. So they want to come in, they want to work a normal working week like everybody else in the population, and in order to do that they are reducing and working part-time. I think as a profession we sometimes shoot ourselves in the foot because if we complain we put our junior colleagues off coming in to primary care, but I think the answer isn't necessarily in increasing the number of GPs. It's about expanding the other workforce, but it's about increasing the overall budget that goes into primary care, because it's gradually been falling. It's less than 9% of the total NHS budget now. But the real thing that would help us is if our patients had better housing, if they had better, if they didn't get sick in the first place, if they had better education, etc. So all those social determinants of what makes them, there's no point in having more GPs if the churn just keeps coming through. Better social care funding and provision would make a massive difference to our workload as well.
Is there any evidence that people are going via the hospital rather than GP, that they're just sidestepping GPs now and just going straight to the hospital with a?
Activity within primary care is up around about 10%. Activity in A&E is up about 10%. Activity at the walk-in centres is up about 42%. There's just a huge amount of demand. I think there is, to a certain extent, I wonder if it's a bit like the petrol crisis or shortage that wasn't a shortage, that idea that health appointments are in such short supply is generating a little bit of demand. I think that the pandemic has increased levels of health anxiety massively, and so we are seeing a lot of people who previously might have done some self-care are presenting with earlier in an illness or with more minor illness. So the huge number of different reasons.
The main thing is, though, to get that information out there to people, because I think I wrote to you about somebody that contacted me about not having a service, and that was before it became more, before the whole thing blew up about. GPs got quite a lot of stick from the government, didn't they? And of course you had to retaliate and say this is one of the reasons. But I've had quite a few complaints about that, but they weren't aware of what the problems were within. They think, like you said before, that oh well, do you know what, everything's getting back to normal now, we can all go back to seeing a GP face to face. It doesn't quite work like that, and I'm grateful to you for producing this for us, and obviously we can then get that out as well, get that information out. So you've had a double whammy tonight, haven't you, on this? So you've got your next report as well.
Sorry, yeah, I just wanted to first of all thank you for the presentation. I just wanted to just put on record, because I know that there's a lot of negatives that's going around about primary care at the minute, predominantly aimed at GPs as well. So I just wanted to really say thank you for everything that all the GPs are doing, all of our NHS colleagues are doing to make sure that we're all safe and well, whatever guise that might be in, whether it's virtual or physical. People are still working around the clock in their own time as well to make sure that we're all safe. So thank you very much.
Thank you, Chair. Thank you very much, Fiona, for the report, and Carol for all the work you do. Some years ago, before COVID, there was supposed to be an exchange program where they were looking at doctors from from secondary care coming out in primary care because of that shortage. I don't know if because of COVID that's been shelved, but I know there are some registrars who are leaving the hospital setting, going into the community. Now, if you're saying about not wanting to be partners, again, they're going to leave. So it's what incentive there are to, bearing in mind there is a shortage, to make it more attractive for the younger ones to stay.
We do have more junior doctors, so the very newly qualified doctors do now spend more time in primary care, which is a double-edged sword. It does increase some capacity, but they require more supervision. The risks, because we work solo, if you like, within primary care, they require more supervision. They're not working as part of a team in the way that they do in the hospital. I think until we address all of the things that I've talked about tonight, it's not going to be a more attractive option, because there are golden handshakes for really under-doctored areas, but they don't seem to make a lot of difference either. So I think we also need the government to value what primary care delivers, and at the moment it doesn't feel like they do.
Thank you, Madam Chair. Thanks, Fiona, for the report. I know the calves can't fit the head. We have to have variety. But what I want to ask you really is about the BIM community. I don't know if you are aware about Tracy Gore. She's doing a research or something funded by the Liverpool City Council, looking into the health service by the BIM community. And what is coming up all the time is access to GP. Then she came to our community to speak to us, and all they were saying, the older ones, they can't really use the internet. I know we're saying is the way forward. And telephone consultation, they don't like it. And to be honest, you know, I can communicate, and now I don't even bother to contact my GP because I know I'm going to be digitally told to wait for my GP to contact me. So I will try and use whatever I can to relieve my pain, which I've got like pad on now on my knee, and it's quite bad. So not everybody is going to, you know, use the face-to-face, use the telephone consultation. We will still like that face-to-face because, you know, when you go to your GP, you might go with your physical problem, and he himself or she might detect that you are depressed. You understand? That's missing. You know, it is missing. I know we can never go back to the old way, but don't let us throw the baby out of the bath. Is that what they say in English? Let's look at it. And maybe those older folks, maybe we can say in each GP to prioritize them to say, this one can't get to the surgery anyway. The old doctors used to visit them, but they can't anymore, okay? But maybe they will say, okay, we have a couple of older ones. We bring them in to do some, to assess them, to make sure they're well. For 18 months, I haven't been to my GP because I felt there's no point. They're busy, you know. So I think we need to look at it more broader. When that consultation comes out, I hope Tracy will share it with the CCJ as well with the Health and Wellbeing Board. I think she said she would, and you will see what come out of that as well. It can be used for GPs to access to GP, for them to look at the access to GP. But that's what they're saying. I still have somebody that emailed me with 12 ladies. They talk to 12 people. They talk to within the BIM community. Their questions, their answers. I've got it in my phone, and I think it's just how do we go forward for the elderly. I know the young one are okay with the internet booking your appointment. I tell you my story. I booked my appointment for my blood. I live by Gaston, and I thought I picked Gaston. But when I got there for my appointment, they said, no, you are going to speak. Then I said, well, I thought I picked Gaston because it's appointment system. You know, you take and take. Anyway, she said, you take Gaston. So, and my appointment was 10 o'clock. She said, do you drive? Because you have to go to speak. So if I don't drive, it's 2 buses to speak. That's just an example. And I'm okay with computer, but I made a mistake. You understand? And that's what I'm saying, you know, so.
Thanks. I think the point is that there is an option of having, I mean, if somebody's serious enough, the GP will see them on a face-to-face, won't they?
Yeah, I think what we should be doing is providing remote access for people who want and have problems that it is suitable for, to free up time for those who need face-to-face. And that's why the obsession with everybody going back to face-to-face is not actually going to help the people who actually need it. And we have to be able to, and each practice needs to understand its own population and provide the right, so some in the city centre, the student population, they might be 90% remote, 10% face-to-face, others might be the other way around. So we have to take what we learn from the vaccination programme about how we actually really get access better for every population, and we have to apply that to general practice recovery.
Brilliant. Any more questions? No? Thanks so much. Honestly, I do appreciate it, Fiona. I know the pressures that you're under. Really appreciate it. We don't mean to give you any stick, you know. You just, it's all right. No, I think we did last month. Yeah, no, I'm grateful. It's all the government's fault, basically. That's what we just have to say. That's it. Forget it. Right, moving on to the next agenda. Carol, are you going to introduce this one? For the the health issues report. Sorry, I've got you down as doing this one, are you?
Yes, thanks, Chair.
Okay.
So I'll take the health issues report as read. I'll just pull out a couple of things. I think we've already talked about the first item around supporting people to get through the winter. I think we've already covered in Fiona's update largely. So next item is about the CQC inspection of Liverpool University hospitals. Councillors, certainly the Select Committee, should have been briefed by the Trust on the outcome of that inspection, which was an unannounced inspection in the summer, which led to a downgrading of their rating from good to requires improvement. So within that, the subcategories of the inspection were around safety and well-led. So I think in particular the well-led domain from the inspection led to an inadequate rating. So what they found were that there were particular issues around flow through emergency, the A&E department, that were affecting the ability of staff to deliver safe care, and that included long delays, and which can obviously lead to people being harmed. And there were also comments about the medical wards and prioritisation of patients for treatment in those wards. I think encouragingly, frontline staff were praised, and this has been difficult for staff. Frontline staff, given the huge amount of work and commitment and the stress that they've been under for sustained periods of time during the pandemic. But it was very clear that that staff were seen to be, as well as being under pressure, that they maintained their compassion and their kindness and the consideration of individual patients, which obviously is encouraging. So the important thing is what's happening, what's being done as a result of that inspection. The Trust has been proactive. As you will probably know, there have been some changes in leadership within the Trust, and currently there is an interim Chief Exec, Sir David Dalton, who is overseeing some of those changes. And we are seeing evidence of improvement. There are plans in place to address the findings of the CQC report, and there is a performance improvement group. From the CCG's perspective, we are supporting the Trust, as are other system leaders. So the whole system is looking to see how we can support the improvements that do need to be made, and we can continue to update the Select Committee on that as we go forward. So I'll just move on to the next. I'll take questions perhaps at the end. So next item was around Merseycare introducing the student health line across Merseyside. This was really about anticipating some of the additional pressures that might occur when students came back in September. We've got thousands of students in the city, some of whom will have health needs over the year. We do encourage students to be registered with a GP, but that doesn't always happen. And what we do tend to see is increased pressures on A&E and walk-in centres. So the student line was really about something specific for students in terms of getting advice and signposting to the right services. It's not in the report, but we can report that we are going to be reopening the Beat, the walk-in centre in the city centre by the end of November, which will add some more local capacity in terms of that local access, with a lot of students being located in the city centre. So we hope that will help as well in terms of providing the right care in the right place for students. Next item was around shielding, and some research that's been conducted about the impact of on clinically extremely vulnerable people in the city. This was done along with Wirral, and I don't suppose it's really surprising that people who are extremely clinically vulnerable have
had significant impacts on them as a result of COVID, both in their physical health, their mental health, and those unmet needs because of the situation in terms of the pandemic. I think what is interesting that has also come out of this is, some of you may remember at the beginning of the pandemic, we were asked to identify, or clinicians, GPs in particular, were asked to identify clinically extremely vulnerable people on their registers. Liverpool identified probably the highest number of clinically extremely vulnerable people in the whole country, and we were really questioned about that. We stuck to our guns because we knew that there were a lot of people who were extremely vulnerable, and also that those people, if they were identified, would get support from the council through the funding that was made available. I think we were vindicated on that later on when the gap that was seen between our figures and the work that was done to identify those people later on, we had the smallest gap. So I think we did do the right thing, even though we know that that group of people in the city still have huge needs to be met going forward. And then the final item is just an update on the COVID-19 boosters. I think that's probably been covered already. I think the key message there is that that we are right in the middle of that programme at the moment. Booked appointments, the activity is really the clinics are full, but we still have quite a big job to do to encourage more people to come forward for their boosters. The government did announce, or NHS England announced last week, that we were able to open up appointments further in advance, so that when people do become eligible, they can book in advance of that eligibility date, so there isn't a gap between when they are eligible and when they can get their booster. So that will help as well. So happy to take any questions.
Thanks, Carol. Any questions about this report, Liz?
Sorry, I wasn't going to say anything tonight either, was I? I know. Just ignore me, I'm a liar. I know, yeah. Can I just ask a specific one about students and the Mercy Care? Usually around students coming back, we have big campaigns around meningitis vaccines for people coming into university for the first time. Is that still happening? Does that still go on? Because I've not seen anything about that recently. Or is that not anything that happens anymore? Meningitis vaccines for first-time students when they come away. So, yeah, we used to have a campaign around the autumn around encouraging new students to take up the meningitis vaccines, and I obviously haven't seen anything. And I didn't know if it was a casualty of COVID or it's just not something that is promoted anymore.
I wonder, but I'm fair to Matt, if it's because meningitis vaccination is now done as part of the routine immunisation schedule at 14. And so they aren't arriving unvaccinated, so there isn't the need for it. I don't think we've done it for a few years, but let's check it. Yeah.
Okay. Right, the scrutiny panel update. Just to tell you that the first meeting of the Joint Health Scrutiny Committee is taking place on Thursday at 4 p.m. That's for the hyperacute stroke services. So the participating local authorities are Liverpool, Knowsley, Sefton and Lancashire. I think me and Liz are on that, aren't we? Yeah. So the minutes and the feedback from that particular meeting will be received at the next meeting of this committee. So moving on, item 12, scheme of delegation. So that's on report is on page 52 to 64 of the agenda, and it provides a summary of decisions made under delegated powers by the Director of Adult Social Care and Health and by the Director of Public Health. Not you, Steve, you've not done any. I'm not allowed. Oh, that's just good. Yeah, I can see the point. Okay. Have we got any questions on this? No? Oh, that's great. All right, moving swiftly on. So that report's for noting. Is that agreed again? Yep. Okay. Oh, we're doing really well here. So the date and time of the next meeting is Monday, the 24th of January at 5 p.m. in this particular venue. That is a change of date. It was due to be on the 11th or something like that. So just make sure your diaries are updated. So that's on the 24th. I think that's about all there is. Can I thank everyone for attending the meeting tonight? And I formally close the meeting. Thank you very much. Thank you.